It is a stimulating adaptogen. You think ginseng stimulating? Forget it. Rhodiola is very stimulating. So think about it in people with dysthymia, people with chronic fatigue, people with fibromyalgia, people that have chronic pain and depression. Rhodiola is used in people who you want to sort of, bump their chi. You want to sort of invigorate them. Almost the opposite of ashwagandha. It is considered an anti-fatigue agent in Sweden. It is their most common psychostimulant, non-pharmaceutical psychostimulant aid that's used in Scandinavia. It's a beautiful plant. Depression, fatigue, chronic burnout. I don't know how to, in most people with chronic fatigue syndrome, chronic pain with depression and fatigue, rhodiola is almost always a mainstay in those formulations. This was a burnout study that was done. It was an open-label trial, 118 outpatients with burnout that had burnout syndrome. They used a whole bunch of validated scales. They used 400 milligrams per day of a rhodiola extract. It's one that's been used quite often in a number of these trials. It was 12 weeks. They found significant improvement in multiple parameters with anxiety, with exhaustion, etc. 10% of the people who took it had possibly related adverse events. Head pressure, lightheadedness, feeling irritated, some eye swelling. The irritation part is very real. So this is what I say. Some of these people, those 10% probably would have done better on ashwagandha, right? You treat everybody like they're burned out. You're not checking cortisol. You're not doing anything like that. You just treat everybody like they're the same and you give them rhodiola. You give me rhodiola, I'm like the Duracell bunny, man. I will not go to sleep. I'm running all day because it just jacks me up too much. It's not appropriate for my constitution. So rhodiola, I really want you to think burnout with fatigue, pain, your chronic pain patients, maybe that are very tired, low cortisol. At 3 months, I don't know if you know this, but most of the data shows by 3 months, patients with chronic pain have very low cortisol and very little ability for their adrenals to adapt to stressful situations. Rhodiola, much more profound in this kind of group of people. Next slide. Mood, there's been 11 trials looking at it for depressed mood and fatigue. All of those have showed a tendency towards improvement. There was a number of studies looking, one study at UCLA looked at this for anxiety, found it was beneficial. I think you'd have to get the right person. I think many people with rhodiola who are anxious become more anxious. Next. There was a recent review looking at rhodiola may be beneficial in women going through menopause. I read the article. I'm not sure what all that's based on. I think it's more of the basic science. A lot of us don't use it extensively in menopause, but in some women it might be just right? When you're looking at somebody who's got fatigue and depression and it's hard to get them up and moving, that's the person you would think about. There are drug interactions possible with rhodiola. In humans, you can have problems with the sulfonylureas, phenytoin, warfarin, because it impacts CYP2C9. So all my students yesterday, I gave you all those charts. Rhodiola is one that can interact with CYP2C9 in humans. My advice on rhodiola, make friends with this plant because there are a subset of your patients that will truly benefit from it, but go slow. Start low, go slow. 150, 200 milligrams of an extract, and then after a week, increase it. Many times people will have to be dosed the majority in the morning with a very small dose early in the afternoon. If you give it to them like at dinner at nighttime, they will not sleep. So it's better dosed earlier in the day, and if you have to dose it in the second, do it earlier in the afternoon. Okay, so I do love ginseng. I've loved ginseng ever since I first learned about it when I started taking martial arts a long time ago. And there's Asian ginsengs, a number of different types, and there's American ginseng, and there's ginseng that grows in Vietnam. There's a number of Panax species that grow around the world. People think of ginseng as something you give like an athlete to make them more athletic. It's a total disturbance of what ginseng actually is used for. It's typically used for people who are convalescing, people who've been weakened, people who are mentally and physically fatigued. It's not for, they used to do studies in Navy SEALs. They would do it in Navy SEALs. My nephew went through Navy SEAL training. I'm like, you give a Navy SEAL who's already at the very pinnacle of sort of people who can tolerate a lot of stress and are very athletic, and then you give them a placebo or you give them ginseng and you're expecting to see something? You're not. There's no room. So we've looked at ginseng in sort of a bizarre way in the United States. Ginseng is really a deep tonic, particularly for people who sort of have a low vibrancy, a low chi, somebody who's been quite sick maybe. Next. So we know that Panax ginseng has antiviral activity. It does have antiviral activity specifically, but like many of the mushrooms, it seems to work primarily by enhancing the host defense, making your body be more effective at fighting off viruses. Panax quinquefolium, or American ginseng, was actually shown in patients with CLL to actually reduce the number of respiratory infections that these people had. So again, looking at this in patients with cancer, people who have diminished immune response. We know that it has beneficial effects on a number of metabolic parameters in the body. Think of it in Raynaud's. We think of prickly ash, we think of a number of things when we're thinking of Raynaud's. Ginger, but red ginseng, Korean red ginseng, very, very good for people with cold extremities. But think about this also in older people who have always cold hands, cold feet. Many of these older people benefit from the use of 6 to 8 weeks of ginseng and improve cognitive function in healthy adults. So there was a lot of research that went on to see if ginseng actually would interact with medications and drugs, and the good news, and I'll show you the slide in a moment, is that it didn't. So one of the areas that researchers wanted to look at is, could you give ginseng to people undergoing chemotherapy or radiation, and could it reduce cancer-related fatigue? This is a huge problem. I mean, yes, when you're going through chemoradiation, you want to make sure you're killing off the cancer and you're protecting healthy cells. But many people get treatment breaks for a whole variety of reasons, because the fatigue can be absolutely debilitating. There was a randomized controlled trial using 2,000 milligrams of American ginseng from Wisconsin, so it came from Wisconsin, good quality ginseng, and it was done in more than 40 cancer institutions across the United States, and what they found was a significant difference between the placebo group and the group that got the ginseng. The people that got the ginseng had much less fatigue than the people who took the placebo. I think this is wonderful news, because it also speaks to what I said earlier. This is not for Navy SEALs. This is for people who are convalescing, who are quite ill, that you want deep adaptogenic sort of strengthening. Ginseng is excellent, both Asian and American. Next. Back one. So there was a number of studies that had to be done in human beings using real FDA-approved probe drugs to see, will ginseng, when you take it orally in the doses we're going to use, does it interact with medications? And the answer is no. 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 Which is why there was IRB approval to give it with all these chemotherapy drugs. There's just no interaction. Next. There's also been in our literature and amongst herbalists this notion that kind of trying to, almost distorting, trying to take a TCM way of looking at physiology and translating that into just like right across the board in Western physiology. Difficult to do unless you really know what you're doing. So I've heard throughout my career that ginseng affects blood pressure. And yet all the people I've used it on in all the clinical trials, you see no elevation in blood pressure, you usually see a reduction. So this was a systematic review of all the trials that had been done, and we've looked at this from adverse event reports as well. Ginseng actually does not elevate systolic blood pressure, diastolic, or affect mean arterial pressure. As a matter of fact, it induces nitric oxide, causing coronary circulation to open and also having a mild blood pressure lowering effect, whether you're talking Korean red ginseng, white ginseng, or American ginseng. So these are sometimes because we said, people shouldn't take this who have red, hot, heat, constitutions, we then extrapolated that to blood pressure. The other thing I would tell you is most of the problems that we saw with blood pressure in the United States were 25 years ago, and they were from adulterated ginseng. We used to cut ginseng with ephedrine. I mean, ginseng was the most adulterated product in the United States for so long because people here in the United States wanted to take ginseng to get jacked up, like a caffeine. And ginseng just doesn't work that way.